And I'm the Health Promotion Project Manager with North American Management. And I just wanted to thank everyone for attending our webinar today. It will be Project Brotherhood, and they are presenting on innovative outreach methods. And we have Dr. Thomas and Dr. Mason presenting first. And then we'll have Mr. Marcus Mary, who is the Executive Director, and Mr. Perrin Green, who is the Program Manager. Dr. Thomas, are you ready?
Well, first I just want to say thank you. I appreciate you guys having us here, and hopefully you can get a lot out of this and try to share this with some of the other funding sources so we can get our men healthier. So the name of our talk is Sick and Tired of Being Sick and Tired. And as you can see, Project Brotherhood has a rich history of providing care for black men. We have a number of awards here, which I'm not going to go over here. You can read that on your own. But, of course, we've been on CNN, and we've been acknowledged by the CDC. And, you know, the pillar of what we do is based on sort of two basic principles. One is the WHO definition of health, which says that health is not simply the absence of disease, but the presence of physical, mental, social, and economic well-being. And so hopefully what we can do is, you know, this essentially describes a holistic way of providing care. Someone that has diabetes is not simply a diabetic patient, but he's a patient that has a number of needs that includes social, economic, as well as spiritual well-being to help provide care for this patient. The other definition of health that we consider that's paramount is the People's Health Charter, which says that health is a social, economic, political issue. Above all, it's a fundamental human right. Inequality, poverty, exploitation, violence, injustice are all the roots of ill health and the deaths of poor and marginalized people. Health for all means that powerful interests have to be challenged, globalization has to be opposed, and that political and economic priorities has to be dramatically changed. So with that being said, you all are familiar with the fact that African American men has the highest death rate among all ethnicities, and in particular, coronary disease is one of the major causes of that. As you can see, African American men have the highest rate of coronary disease, and this is according to the CDC, and this is not unchanged from cancer as well as stroke. The leading cause of death of black men, according to the CDC, depending on the age, you have some of our younger men who are dying from homicide and unintentional injuries. And then, of course, as we get older, heart disease and cancer becomes the leading causes of death. And in Chicago, we're really feeling the crunch of our young men being victims of violence and homicide. So this is something that we're particularly concerned about, and I think it coincides with this talk about outreach and getting to these young men.
And one of the main things, if you look when black men reach the age of 35, with heart disease and cancer, we know for a fact the reason that, well, first of all, these are preventable diseases. So the reason black men are dying from them is because they're not having access to the medical care. Nobody's doing outreach to them, and they're not getting screened.
Yeah, and then in addition to that, you know, many of our men are living in food deserts, not having access to fruit and vegetables, and are living off of you know, a high saturated fat diet that's pretty much accelerating the atherosclerosis.
And one of the things that we found is when African American men did get access to health care, they felt that the health care that they provided wasn't fit or wasn't right for them. They felt they were being disrespected. They felt that in many cases when they walked into the health center, that it was assumed they were there for an STD, that they really were feeling disrespected. And so we'll get to the focus groups that we did, sort of ask the men in the community, what's keeping you from health care and what can we do to design a clinic that'll make you want to come.
So this is how we got started. In 1998, there were a team of medical professionals, from doctors, trauma surgeons, nurses, social workers, that just got tired of seeing black men access care through the emergency room and not having any follow-up care with any primary physicians. So what Project Brotherhood did, now they call it, it's nothing new, now they call it community-based participatory research. We went to the men. We had 11 focus groups with black men of all different backgrounds, shapes, sizes, colors, economic status, sexual orientation, and we asked them, why don't you come to the doctor? Some of the things they said was, first, they couldn't afford the doctor. Second, they said they didn't trust the medical community, whether it was from the Tuskegee experience, whether it was from people not looking like them, talking like them, sounding like them. There was just a cultural difference between black men and some of the medical providers or medical institutions that they were going to. They didn't have jobs. If a brother had a choice of missing work or coming to the doctor, we know a brother's not going to miss work. And then, to be honest with you, all men are just macho. So if it doesn't affect their sexual organ, men won't come to the doctor. And it was fear of the unknown. Nobody wants to come to the doctor and have to get hurt, get told some bad news. They didn't want to come with long waiting times. And men just basically were trying to take care of their families. They also said there was racism. Racism meaning, you know, the cultural absence of people that look like them and sound like them. And if you just look at the clinic in general, most clinics have Oprah magazines, Martha Stewart magazines. They're not set up for black men. So when black men come in, the first thing people assume is that they're in here for some type of STD or STI.
So some of the things that the men stated on their focus group was that when we asked them, you know, what are the factors that keep you from seeing the doctor? A great majority of them stated that lack of money or lack of insurance was the two major causes of them not seeking health care. When asked, you know, why don't African American men live long, you know, many of them listed the fact that we're not seeing the doctor, and also they listed poverty as one of the reasons why we don't live long. So what we found was that the men were not unaware of the reasons why they were at the leading causes of death of many of those diseases, as well as why they don't seek health care. They're well informed of this. When asked what are the factors that contribute to the inability of them seeing the doctor, many of them listed again the economy and lack of jobs. So it goes back to our original pillars of the People Health Charter, as well as the other, the WHO definition of health. The fact that economy is a major, economics is a major cause of health care. So what are the goals of Project Brotherhood?
The goals of Project Brotherhood are to create a male-friendly place where men can come and feel respected as they access health care. And it's important that we note that our model of health is not just about prescribing medicine. It's a holistic, multidisciplinary approach where we have doctors working side by side with social workers, with master-level social workers, lay health workers, the front desk staff. Everyone is considered equal in the way that they can impact someone's health. And every interaction, from the doctor to the receptionist to the barber, all plays a critical and equal role in how we treat men.
And so one of the logic models that we use, and as you can see here, our logic model just essentially, and I don't want to go into great detail here, you can read it for yourself, but the main thing is that there's an intricate relationship between the health problems that our men see, and as well as some of the root problems, which is racism, health disparities, lack of jobs, the over-criminalization of African American men, and what are the things that sort of set men up for ill health, as well as lack of resources in our community. And so when we provide care, our desire is that our men see this as a place where they feel comfortable, they can come to, and part of that comfort level includes the front staff all the way to the physician when they leave, and including the leadership of the health center as well as the leadership of Project Brotherhood.
And one way that we introduce that level of trust and comfort into the health center is that we have a barber at the health center that cuts hair for free. And that barber has really been the center and focus of Project Brotherhood over the years. And while they're cutting one of the clients' hair, they'll talk to them about what's going on in their lives and see if they need to be connected with a doctor or a social worker or need help with getting online applications done for jobs, and sort of route them to the best person within our team that can help them with whatever they need. And so that's one of the unique things that we have here. And for many years, people knew that they could come here to get a free haircut, and that was one of our biggest draws. And once we got them in, they said, oh, whoa, you're a doctor? Oh, you can help me out with this? Oh, you're a social worker? I've never interacted with a social worker before. So, and our social support group, which is led by our master level social worker, uses cognitive behavioral therapy to lead a group. Usually every Thursday we have about 30 men talking about a wide range of topics, from what's going on here in Chicago. We may have a talk on colon cancer, prostate cancer prevention, and it's really powerful to see some of the men, for example, in the colon cancer prevention talk, to stand up and say, I've had a colonoscopy. And so the other men in the group can learn from his experiences, as not very many black men in our community have had colonoscopies before. So we really, take the motto that everyone is a valuable member here in order to help other men in the health center get healthy.
So some of our other services, as you heard Dr. Mason say, we have the barber. The barber is important because if you feel good, you look good. And barbers are essential in the black community. People go to the barbershop and they talk to the barber as though that's their priest. We also have manhood development classes, which will slash a rites of passage class, and a fatherhood class. Both these classes were 8 weeks. After the 8 weeks, we would graduate the men. Why? Because that's important. Some of the men haven't participated in many graduations, if any. So we wouldn't shut down the clinic in terms of medical services, but in terms of social services, we would shut down the clinic and celebrate these men's accomplishment of participating in this class for 8 weeks. We have job readiness and referrals. We don't actually guarantee men a job, but we can help them with their resume. We have job leads on our job board. We let them get on the internet and set up an email account and do online applications. This is very important. A lot of these men are transitional. They might not have phones. At the beginning, the government didn't give away free cell phones. So men need to be able to get in contact with future employers. If you want to apply for UPS, nowadays you have to apply online. So having that email address and just being set up, established in that way helps them out a lot. Of course, we have medical services. Our medical services are provided by 4 black men and 1 female black provider, which is essential. We also have, like we mentioned, free haircuts and free food. Some of our services have dwindled down a little bit because of funding, but we still plan to bring them back up, and they're still useful. That's how you create this safe place. You have to lure men by what they need. If you provide food and free haircuts, especially in Chicago in the wintertime, people are going to come and get it. People are going to utilize it. And once they see brothers that look like them, sound like them, and understand their cultural behavior, they have a tendency to establish that trust. Once you establish that trust, then it's easy to talk to your medical provider about some of your issues. A lot of times men feel uncomfortable saying they might drink a 40-ounce a day. Well, our doctors know. We know alcohol is not good, but we're not going to necessarily label them as an alcoholic or some type of problem person because of what they do. We'll address the other issues. Why are you drinking so much? Would you like to see a social worker? Because that mental health is definitely needed. And a lot of times people think men don't talk. Like we said earlier, we'll have a group of 30 men talking about a variety of topics, from health topics to social issues to dating to how to deal with their kids and just their plain self-esteem. Another thing that we do with our social service, we also have basic social service needs. If men need housing, if they need other social service activities, we have 3 MSW social workers. 1 is a female, 2 black males that provide them with all the services that they might need in terms of getting housing, counseling, referrals to mental clinics, and just things of that nature. But the strongest point that keeps Project Brotherhood solid is our medical services. Now, we average about 35 black men a week and allow for 10 walk-ins. That's in a 3-hour span.
So some of the things that we see on a routine basis, we see a lot of, and let me just say this. So from the very beginning, most of the men were seeking service here were for physical exams, were for basic like acute needs, if it's some sort of STI or something like that. Now we're seeing a dramatic increase in chronic disease, diabetes, coronary disease, congestive heart failure, renal disease. And this might be reflective of the fact that now, these are issues that, in general, the country is experiencing. And so African American men, of course, being a part of this country, we're seeing an increase in chronic disease. But also, these are men who previously did not have care. And so when they are seen at someone else's emergency room and they do not have insurance, the emergency rooms in this area and in Chicago are familiar and know about Project Brotherhood, know about our desire to see men who will do everything in our power not to turn them away, to provide quality care for them.
And one thing you may be thinking is, how are we paying for this? So it's important that we say that we're part of the Cook County Health and Hospital System, which is the public safety net system here in Cook County. And we have sort of a regional universal health care system where all of the people living in Cook County pay taxes and help to support the system that we work in. So we currently have 2 hospitals, John H. Stroger Hospital and Provident Hospital, and 13 ambulatory community health clinics, and Woodlawn Health Center is one of those community health centers where Project Brotherhood is housed. So, and at the hospital, we are very fortunate to have an array of specialty and subspecialty services. So if any of the men need to see any type of specialist or surgeon, we can refer them to the hospital for that.
And a referral from Project Brotherhood gets you in quicker than just actually going through the county.
Yeah. And the other piece is that we also, I know a buzzword you may have been hearing lately is about this whole issue of patient-centered medical home. Well, we've been applying that principle from the very beginning, with the exception just that the physician isn't the pivotal person there, but that our entire team is the pivotal person. In fact, you can even say the barber is the pivotal person, because here's the person that actually breaks down the barriers and allow the men to feel comfortable here and decide that they want to see the doctor.
And you see some of the components of a patient-centered medical home on the screen right now: real-time appointments, walk-in services. These are things that a lot of health centers are trying to adopt and implement currently, and we've been using this strategy and this model for years.
Okay, and Project Brotherhood also assists with medical resident and student training. We actually partner with a lot of local universities in the Chicagoland area, from DePaul, University of Chicago, Northwestern, and Loyola medical schools. And the medical students actually come to Project Brotherhood for a session. They'll shadow, our doctors, including Dr. Thomas and Dr. Mason. And a couple of things that they, learn, of course, cultural competency, so learning how to work with, underprivileged populations, learning how to work with different race and ethnicities. Also, the medical students participate in presentations. They come to the social support group and talk about HIV, diabetes, heart disease, and also students of all types I use. We use medical students who are training to be doctors, pharmacy students, nursing, physician assistants. We also have a big high school component where students who are looking to get a career in the medical field will actually come to Project Brotherhood, observe the session, work with the doctors, and just kind of figure out what a career in the medical field is actually like.
So as we talked about earlier, we talked about the importance of the barber. The barber also serves as a navigator for Project Brotherhood, meaning when men come in, a lot of times the first thing they do, they ask the barber, now what's going on with this place? Is this place cool? Are these doctors okay? And all our barbers are trained. We train our barbers in colorectal cancer, in HIV. We give them health tips about stress and cardiovascular disease, things of that nature, so they can serve as a navigator and to kind of dispel the myths that most black men have for the medical system. But one thing we like to do and what we've created from Project Brotherhood and what we're about to get into is our outreach. The biggest outreach component for Project Brotherhood are the brothers themselves. Once you treat a brother right, a brother will be your biggest advocate. We don't have the money to go out and do mass marketing and put up flyers and billboards and commercials like a lot of these healthcare systems are doing. The brothers actually go out on the street and say, hey, these brothers do good work. These brothers will treat you like a human being. They created a place where I can come and receive respect and love, and we don't ask them for anything. And that's very, very important when dealing with black men. You have to be honest with them, and you have to meet them where they are. So a lot of things we do is just that. We meet black men where they are. In the earlier years and up to now, if we're lucky enough with funding to have high school students or we have our interns, we walk the streets of Chicago. We walk to commute throughout Woodlawn, which is the community that we serve, and other places in Chicago, and we pass out condoms and flyers about health tips, about just any health disparities out there that black men might actually go through. We'll meet them at the basketball clubs. We'll meet them at softball. There's a softball, Chicago plays 16-inch softball. Every Sunday we have the oldest black league in the country with approximately 1,300 men that are playing. We go out there and offer screenings and tests. And it's not just outreach workers. A lot of times our doctors come out there. So when these men see a doctor, a physician coming out there talking about, hey, I want to help you. I want to help you become healthy, that does wonders for their self-esteem, and it establishes the trust. And our doctors, a lot of times, I like to tease the doctors. A lot of times they don't wear the, fancy suits when they come out there. They come out there like regular black men in their jeans and their Timberlands, T-shirts, and they fit right into the community. So they don't establish that upper echelon or that hierarchy. We do a lot of health fairs. We do a lot of talks in schools and universities, just wherever we go. I know personally, several times we keep flyers in our car. So when brothers ask us for spare change at the gas station, we tell them, come to Project Brotherhood and give them a flyer. We might write down our name and our actual phone number, and we become health advocates for the community.
And as Marcus is saying, we meet the men where they are, and one of the most important things if you're going to be trying to design an intervention is to involve people from the community in the program. And so don't, just bring people in and hire people. Just make sure the most important thing is really to find and recruit folks from the community to get involved in your programs.
And that means a lot. And we understand what the men go through. All of us, even though we're health professionals, we still get harassed by the police. We still live in a community. In other words, we live in the hood. So the same things that they go through are the same things that we feel in effect, whether it's hearing gunshots, whether it's, safety for our children coming outside. But these things play an important role. And just seeing black men from the ages of 16 to, I won't give away our age, but to under 50 out there doing something positive has a good effect on the community. In Chicago, there's a major street that leads to south called Lakeshore Drive, where most of the working people take Lakeshore Drive to go downtown. We'll often get out there in the summertime at 6 in the morning with high school students and ourselves and pass out condoms to people getting on the bus. We'll take a street team approach like they used to do in hip-hop, and we'll have big signs and walk in the middle of the street. Have you been HIV tested? Go see the doctor. When's the last time you seen the doctor? We use a language that black men can understand, and we speak to them, and this strategy works. And as you can see in this slide, we have a lot of summer students. Our summer students not always are black men. That's a young Indian woman there, and she helps with the outreach. We'll go to health fairs and other community centers.
Colorectal cancer is the second leading cause of cancer death, and African American have the highest number of new cases. There's a decline in colorectal cancer mortality in all groups except for black men. And African Americans, and especially African American men, are less likely to receive screening for colorectal cancer. And as a response to this data, Project Brotherhood developed a unique and innovative, culturally specific colorectal cancer prevention program to address these issues. So our goals of our colorectal cancer prevention grant was to, one, increase awareness of colorectal cancer among black men in Chicago, two, to increase the screening rate here at the Woodlawn Health Center on the south side of Chicago, and to do barbershop outreach, where we connected with barbershops and trained barbers to talk to their clients about colorectal cancer and prevention. So what we did, we started out by using the American Cancer Society's colorectal cancer prevention curriculum, and we got a group of men here at Project Brotherhood to take a look at it. We had a focus group, and we refined it and made it culturally and gender specific for our men here on the south side. The next thing we did was we trained barbers. Marcus and Matt, they went out and reached out into the community and got barbershops to be a part of the program. Each shop, we had 2 barbers come in, and we trained them on the anatomy of the gastrointestinal tract. We talked to them about the structure and function of the GI system. We started out by just asking them what they thought health was, and sort of told them about our model of health, that health is a holistic and multidisciplinary, and it's not just about medicine. So we talked about colon cancer. We asked a lot of the men, what is cancer? And we got a wide range of responses just asking, what is cancer? What is colon cancer? And so we started by dispelling those myths so the barbers could take the correct information back into the community, because no matter what, information is going to go around in a barbershop, whether it's true or not. And so we made sure that we armed the barbers with as much information as possible so that they could help bring that information back to the community. So we talked to them about the different ways to screen for colon cancer: colonoscopy, flexible sigmoidoscopy, fecal occult blood testing card, fit testing. And we also added in training about HIV prevention, prostate cancer screening and prevention. We did a pre-test and a post-test before and after the training to assess the barber's level of knowledge regarding all of the health topics that we discussed. We did a baseline chart audit and found that only 18% of the patients who received fecal occult blood testing returned their cards to the health center. So this is one of the proven methods for colon cancer screening, and one of our goals was to increase the rate of screening here at the health center and to introduce screening into the community. So what we found is once we trained the barbers on colorectal cancer prevention, we actually gave all of the barbers packets to give to their clients that included 3 fecal occult blood testing cards, culturally specific instructions on how to use them. The clients were instructed if they didn't have a primary care provider that they could bring those cards back to our health center and receive primary care through the Woodlawn Health Center. And what we found is after those barbers were trained and were educating their clients about colon cancer, that we had a higher return rate from the barbers after the program than the baseline return rate from providers at the Woodlawn Health Center. So some of the lessons learned from that program is that it's important to reach out into the community and create these partnerships. The barbershops really were eager and really happy to continue working with us once we sort of developed that partnership, and they were branded as a Project Brotherhood shop. And it is more than just a one-time training. So we went out every week to talk with the barbers, make sure that they had any questions, to answer them, to reassess them. We did a post test at 6 months to see if they were retaining the information that we had been working with them on. And they come back, and it's not just colon cancer. We really expanded it to prostate cancer, HIV prevention, oral cancer.
And this was important because it's just another form of outreach. Men in the community got to see, hey, who are these guys giving health tips in the barbershop? What is this Project Brotherhood place? Let me check it out. So then we go into other forms of outreach on how we use live media. Live media meaning the TV and the radio. First we'll start with we incorporated a local Grammy-winning artist, Common. I'm sure you probably heard of him. And he created a public service announcement for Project Brotherhood on prostate cancer. Now this public service announcement is actually getting played on local TV stations, and we just worked out a deal with 2 radio stations to get it played every day for the next year. Why is this important? Because people respect Common. Common's a 40-year-old man. He understands about prostate cancer. It's time for him to get screened. And it adds credibility. So anytime you can use a local celebrity to add credibility helps out. And it's also notoriety. This picture that you actually see when I'm on, he actually wore that during one of Barack Obama's campaigns in Chicago. So he was wearing our Project Brotherhood T-shirt around the president and all the politicians in Illinois. And a T-shirt itself is another incentive that we use. We give out T-shirts. You don't have to win them. You don't have to buy them unless you visit our website and you're employed and you can buy them. But for our clients, we just actually hand them out. As soon as we get them, we give them out, and they go like hotcakes. But this is important because men wear them. Men love stuff for free, from keychains to pins. But the T-shirts are a big draw because they walk the streets, and you will always see. It's like, I don't want to call it a gang, but it's like a society. It's like a group. So when you see a brother with a Project Brotherhood shirt on, it makes them feel good. We'll often be driving down the street and see several brothers with Project Brotherhood shirts on. Another thing on how we use the media is we created a pledge called Take the Pledge. Take the Pledge is basically an urban pledge that we partnered up with Columbia University, who is basically a media type of university. And we created a pledge with 21 acts, from people drinking water, men drinking water, eating fresh fruits and vegetables, just being a responsible citizen in their community. We use the actual men from our program, from our clinic, to film this commercial for this public service announcement. And that, too, is getting played all across the city on local TV stations. And it actually won an award, an international award, beating out other ad agencies as the top PSA for that year. Another thing we did to get our name out there was we had a radio show called the Project Brotherhood Power Hour, where basically the men from the program, everybody that worked here, and then we would also incorporate some of our friends and volunteers from the community, would come on the radio show every Sunday and just talk about issues that affect black men. During the show, we would constantly give health tips. We would talk about dating issues, social issues, raising our children issues. And what that did was let people know that everybody is almost the same. You know, people have some of the same similar thoughts, whether we're doctors, clerks, health professionals, students. It didn't matter. But it got the name out there for Project Brotherhood. We saw our numbers increase. Imagine waking up in the morning and you're being scared to, go to the doctor, and you hear black men on there, let alone a black medical provider, talking about a health issue and telling you you can come in Thursday for free. So we saw a definite increase. Really, it was too much of an increase, but we loved it anyway that black men would seek the medical attention. But we saw a big increase from the radio show and men coming on, men coming back to Project Brotherhood for other services. And we also do little things. In the summertime, we'll put up a basketball hoop in the back. Our doctors come out there and they try to play. Mr. Murray has the best game, so he often dominates. But besides that, when young men and older men see you back there playing basketball, having barbecues, having a weed in the lobby, it lures them in. It makes them come into that safe place. And once they come into that safe place and check us out, then, man, we developed a friend for life. And then we're talking about our website. Now, because we're a small organization, it's hard to keep our website updated. It's currently updated now, but you have to be visible electronically. People need to know you're out there, especially with these smartphones and iPhones out there. People want to check you out before they come in. So when you visit our website, you will find a lot about Project Brotherhood. Unfortunately, like I said, we're a small program, so we can't update it and put as much information on there as we want to, but it's important to be seen, especially when you're dealing with universities, other social media avenues, the regular media. This is very important. Another thing we did was we created the Pro-Grow Pledge. That's the urban pledge that I was talking about. This is so you can see it. You can turn to the next one. This is our outreach where we hit the streets in the morning with one of our Project Brotherhood signs, and we all have on T-shirts. The young students wear collared T-shirts, but we allow them to kind of still be themselves. We pass out condoms, and I remember one day we were out there, and this lady almost cried because I'm sure you hear about all the violence in Chicago. When she saw our young black men out there actually doing something positive, it moved her. She was almost in tears to see that these black men were actually doing something good in the community. Another thing we do is we go to high schools. We talk to students about life skills, even if they don't want to get in the health profession. We tell them the stories of ourselves and our friends and what it takes to be a productive citizen, let alone a strong black man in America. We talk to them on a level where they understand. We teach them about setting goals. We talk to them about just thinking and not reacting, conflict resolution. As you can see, that's our basketball hoop. It got kind of bent from Mr. Murray Duncan, a lot of some of the brothers. But when we first started at Woodline, and we like to talk about condoms a lot and safe sex, especially with the HIV epidemic going on in our community. When we first started in Woodline, before the clinic got Project Brotherhoodized, as we like to say, young men basically will come in here, and Woodline is a gang-infested area, just like the rest of Chicago. And if they had their hat a certain way, or if they looked a certain way, these nurses aren't here anymore. But the nurses wouldn't even give these men condoms. Now we set up condoms. We have a big garbage pail of condoms around the clinic. So now people just come in. They can grab 10 condoms, 20. They can grab 100 condoms. We don't stop them. We encourage them to take it. That's all in creating that safe place. They know, hey, these guys give out condoms. And eventually, they'll open up and start talking to us.
And also, what we have in Chicago is a major picnic. It's an old school house music picnic. House music has a huge following in Chicago. And this is an annual picnic, and sometimes it reaches 50,000 to 100,000 people. So, 50,000 people. So what Project Brotherhood did is we actually provided an Ask the Doctor booth where men and women can come and they can ask, medical questions to an actual Project Brotherhood provider. And of course, we would encourage the man to come and visit Project Brotherhood for that comprehensive medical services. And we also done surveys at this event, so trying to find out more reasons why men don't come to the doctor, why men are not as active as we need them to be in their medical needs.
And this is important too, the outreach to women, because we know women are smarter than men, and women are the backbone of the family. And if these young ladies can tell their brothers, husbands, friends, cousins about a program like this, they'll definitely get them to come. All of us are married. We know if our wives say, hey, you're not getting a kiss tonight till you go to the doctor, we're going to the doctor. That's just what men do. So we understand at Project Brotherhood that it takes a village. It takes a village of different individuals within the healthcare system, within Woodline itself, to our partners. Like we said earlier, we partner with major universities. We have a lot of community partners from intervention houses in terms of people dealing with drug and alcohol issues, to the jail, to Goodwill, to basketball leagues, softball leagues, churches. Churches are a key component in our outreach. We have to go to churches and provide prostate screenings and health talks, which are very important. Anybody that calls Project Brotherhood, we'll partner up with. We partner up with one, as you can see on the slide, one of the people, Safer Foundation. Safer Foundation and some other organizations deal with men coming out of the prison system. So it's very important that they need to know you can come here and get health care services. You can come here and get help on trying to find a job. You can come here and just talk about some of your issues, because I'm sure you face a lot of issues coming out the penitentiary.
So just as a way to close, I mean, I think one of the major principles we want to leave you with is our comprehensive health and logic model that includes the ability for our men to be employed, having access to fresh fruit and vegetables, being in a safe environment, having a place for them to go that they are valued and respected. And it's not just about the medical treatment, but it's also about these social needs and economic needs that influence their ability to be healthy. And in terms of the outreach, which is critical, part of our outreach is our barbers who are long-term partners of ours, who are champions of Project Brotherhood. They will, in many cases, send patients to us. They have signs up in their windows about Project Brotherhood. They have our garbage can that has condoms in it, and we'll frequently go by and fill those back up for them. So it's nice sitting in the chair and getting your hair cut and watching men come up. They don't know you're associated with Project Brotherhood, but they're coming in to get condoms out of that bin. It's real powerful to see. And again, and what we recognize is just that, I mean, there's a percentage of men who in spite of all these efforts, will not go to the doctor. But if we can influence these pillars in our community, like these barbers, and empower them with information, those guys are ultimately, their health is improved by better information. Not always acting on that better information, but at least they will have access to it. And so one of the things that we one of our most, I would say, powerful quotes that we have about health and social injustice is that of all the forms of inequality, injustice in health is the most shocking and most inhumane. This was a quote by Dr. Martin Luther King made in 1966, and I think it embodies why we do what we do and why it's so important that we continue to do it even in the face of challenging fiscal environments.
So now we're ready for any questions.
I just wanted to thank you guys for presenting so much information to us and giving our providers so many ideas on how to reach out to the population. So now I will open it up for questions, and if anyone has any questions, Devin, will you please provide the instructions? So far, I do not see any questions come in. We'll wait a few minutes.
Well, while we're waiting, we'd just like to reiterate one of the main goals in dealing with black men is meeting black men where they are. Don't be afraid to walk to where they are, whether it's a bar, in the community, on the street. Understand brothers, be patient with them, because once you treat them right, black men, just like all people, are loyal, and they like the idea of being treated right with respect and love, and they'll be your biggest advocates. They'll go out on the street for you. They'll pass out flyers for you. Be creative.
And two, the issue with younger black men is social media is important, and again, getting on the radio, having PSAs are important, especially on your more urban stations. Hip hop and R&B are other ways of influencing health, and having the backing of major celebrities like Common. And I think, even though Common has a long history with Project Brotherhood, but you can reach out to athletes, local athletes, or celebrities out of front of your town to say, hey, look, we're really trying to push, prostate cancer screening. Can you help us to do that? I have found that celebrities tend to be helpful in that area.
And don't forget about the women. The women are smart. They're willing to help out black men as well. Reach out to women.
Well, we have had a few questions come in. The
Sure.
first question is, how many patients do you see on average each year?
Average each year, about 1,700 in terms of medical patients, and about 1,400 to 1,600 in terms of other social issues, meaning job screenings, the men just coming in to hang out.
Great, thank you. We have another question regarding the radio station. Was it located at your Project Brotherhood facility, or was it at the local radio station?
It was actually, we forgot to mention, we had 2 radio shows. Every Sunday, it was located at the radio station, and then every third Sunday, we would rush from that show and do another one on an AM station, and both were located at the station. We didn't do any internet radio or anything. It was actually 2 urban stations in Chicago, WVON and 106.3 FM.
Okay, the next question is, do you offer couples counseling, or do you incorporate a male partner in health services?
We don't,
a male partner.
Yes. Well, the first question, we don't discriminate if a young man wants to bring his partner in here, whether it's male or female. But in terms of just male-female relationships, a lot of times we try to deal with the men first, but often there is a need to bring that woman. And as far as male-male relationships, we hate stereotypes and calling brothers MSM and things of that nature. But we definitely see men like that. Dr. Thomas is the only black male HIV specialist in the county that sees men. And we're about to launch in the new year a program specifically for our MSM brothers. Once again, I hate using that label, but it's going to be on a different night. They can still come to the medical services on Thursday, but the things we're going to have a barber for them as well. But the things we're going to push also is, the social component, the navigation system, and this is from what we asked our MSM brothers in the community, and a safety course, meaning they want to learn some type of self-defense course and a fatherhood course, which, this is what they said is some of the issues that they wanted to tackle and conquer. So we really hate using labels, but yes, we do see brothers that are straight and MSM brothers for couples therapy.
Great, thank you. There's another question. Someone wants to know, how did you organize the outreach at the community picnic?
It was really from us. The first year was kind of, let's go out there and try it. And after that, the second year we partnered with American Cancer Society. We had the funding to provide 3 large tents outside and provide food and refreshments. And we would go out there. We would have, our doctors would bring medical residents as well as other doctors to man the booth for a certain amount of time. And then we had our students and other health professionals that would go out there and conduct the surveys. And we passed out incentives. We passed out basketballs, little mini basketballs with Project Brotherhood logo on there. We passed out keychains. Usually Project Brotherhood has a good reputation where we don't need to do this, but if we ask you for your time and your opinion, we like to provide you with some type of incentive. So I think there were approximately 15 people conducted surveys. We might ask those people to, get 50 apiece, and then the doctors manned the tents. And we had male, female, we had Caucasian, Indian, black, because we're known as providing good medical services where people trust us. So it doesn't matter at this point, at this age, with Project Brotherhood, what the actual medical provider looks like in terms of giving out information.
We also the souvenirs that Marcus was referring to. They had our logo on it along with the Cancer Society. So it was like a win-win. I mean, I think that's the other thing, is creating partnerships where both parties win. So the American Cancer Society get their message out there that, hey, we want you to get screened, and we get our message out, which which says, hey, we want you to, get in contact with any family member who's male, or your boyfriend or husband, and have them to come in and see the doctor, either us or his own primary care physician.
Speaking of trust, how long did it take you to actually build trust within the community?
Oh, it took us, actually, 3 to 6 months, if that. For some reason, when you, I don't know how to really put this, but when you look at our staff and you see the brothers, and I can speak for myself. I used to have braids. I'm bald now. I lost all my hair. But I used to have braids. So when you see a healthcare professional in braids, and people assuming, okay, if he's good, you see our doctors don't wear white coats. So when you see those brothers and the other people in the clinic, it was easy for us to establish trust because we didn't look like we were dictating to men. We talked to men. So really, 3 to 6 months.
And I hate to kind of throw out a social work term, but what I like to call it is kind of a counter-transference. And it really goes back to what Mr. Murray said. When you have staff that looks like people from the community, when you have staff that is from the community, when brothers came in and they looked at us, they kind of saw their father, they saw their brother, they saw their uncle, they saw that supportive family member or friend that said, hey, man, this is something, health is all around you, so this is something positive. This is something that you need to be involved in.
Right. On Thursdays, we don't wear suits and slacks. You can come in casual with jeans, sweatpants, shorts. You still have to look professional, but you can come in casual, and that makes a big difference. Because if you walk in our clinic on a Thursday night, you can't tell the staff from the clients.
And I
Great,
think
thank you. Another question has come through. I'm sure everyone is wondering this. How did you reach out to Common?
That's one of our little secrets. No, but actually, Common is a friend of ours, so we reached out to him, and he understands the importance of health. Now, we haven't reached out to other celebrities, but Jamie Foxx has been an advocate for us. Who else? I can't think of anybody else. Soledad O'Brien, Bob Love. People have kind of sought us out and became advocates. But in terms of Common, he was just a friend of ours. So we reached out to him during his busy schedule whenever he's in town, do something for Project Brotherhood. I mean, it takes time, so I can't say if you write a letter to Denzel, he's going to respond. But I'm sure, people know people and just reach out to them.
Great, thank you. Another question is, do you use the men that you serve as outreach workers?
Yeah, I think that's a kind of funny question because we do use them as outreach workers, but we do not directly use them because what will happen is, I think Mr. Murray pointed out, one of the biggest, even in this technology society, one of the biggest things of outreach is word of mouth. So a lot of times the guys will come here and they'll find out about our services, and they'll say, hey, I'm in this basketball league, or I hang out in the park on Saturdays. Can I just get a couple flyers and take them and let other guys know about these services? And whenever a brother comes and asks for, Project Brother materials from us, we definitely, try and give him as many flyers or brochures as we can because, that's the way that he's saying he wants to give back to his community by going to do the outreach itself. If we could, we would love to have the funds and employ the brothers as outreach workers and things of that nature. But just by them coming in and saying they want to spread the knowledge is one way that they're used to kind of spread the word about Project Brotherhood.
Right. Or when we had our walking group, we would meet every Saturday and walk in the local park because just walking in numbers is safer for the community. Men will recruit other men. Like Mr. Green said, men will take our flyers, they would wear our T-shirts, and they would just say, hey, this is a good place, and spread the word in that aspect.
That's great. So the walking group, was that just for men, or was that for entire families?
No, actually, that was just for men. It started from one of our medical students who did a whole bunch of video interviews with men, just talking to them. And one of the men in the group said, "Hey, I want to exercise, but I don't feel safe exercising by myself. So we just spread the word, sent out some flyers around the clinic, and told a couple brothers we'll be meeting at Jackson Park, and we'll start walking at 10 o'clock in the morning. And about 12 to 13 men showed up, and they did this consistently for the summer.
Great, thank you. The next question is, how did the black males react to your organization giving them condoms?
Well, first of all, in Chicago, when you go into the Walgreens and the CVS and the local drugstores, the condoms are locked up. So no matter what age you are, adolescent or adult male, when you go somewhere and you have to go seek out a sales associate and say, I need condoms, and they might have to get on the loudspeaker and say, customer needs assistance in condom aisle number 11. So it's a little difficult for the guys to get condoms. So they felt very ecstatic where they can come to Project Brotherhood and go to these, buckets where, they can just grab as many condoms as they like, where they can fill, paper bags up with condoms. Because another thing, besides the condoms being, locked up, the condoms cost, a lot of money. So if brothers don't have jobs, they really can't afford condoms. So being able to come and get condoms free to protect themselves, they were very ecstatic about that.
And let's keep it on. Let's keep it real. People love free stuff. So when there's condoms or whatever, so if they can get condoms for free, they'll love it.
Thank you. Another question has come through, and they would like to know whether or not you reach out to older men, and if you do, are your techniques different from those you use among younger groups?
It depends on how old, but once again, our patients are our advocates, but yes, we do reach out to older men, and one of the techniques we might use with older men is coming in and saying, create a legacy. Tell us your story. Come by Project Brotherhood and tell us what you went through. Often it will start, too, with some of our medical providers. There's been many a times that one of our doctors will walk a 60-year-old man who's been through something like prostate cancer. He'll walk them back to the group. We don't send them back. Our doctors will actually walk this gentleman back and say, hey, this brother wants to tell a story about what he's been through, what he's seen. So, when they hear that firsthand, that helps out. And then when you come to, old people like to talk. So if you can get them to come and talk about their life experience and some of the things they went through, that's definitely a key and a way to help recruit them.
And I think anytime when you deal with guys or any type of social service group, you also have to kind of create responsibilities and norms of the group. At our social service group, we start our group off with what we like to call libation, which is an African tradition. And the first thing that when you do libation, we ask, do we have permission of our elders? So we create that norm that our elders, are people we look up to. Like Mr. Murray said, they are legacy builders. So when we have respect for our elders, when an elder comes into the room, that elder gets your undivided attention. So it's also about building norms for the guys. And a lot of times, if one guy steps out of that norm, the group will kind of reinforce it. The social work of the person leading the group doesn't even have to say a word. Other guys will say, hey, man, respect the circle. And that's another thing. We sit in the circle because we want to be united. So if a brother, says something out of line or whatever, a lot of times the other brothers will step up and say, please, respect the circle.
And I'll say this, too. I think that's one of the problems I think that we're experiencing in what, the news would call as street violence, is that we've lost that circle. We've lost the respect that the young guys should have for the rest of the community. And again, I'm not placing blame on the victim, because in many cases these young guys are victims themselves of neglect and violence and just lack of opportunities in their communities. So, but I think this issue that we've created here is something that I think the rest of the city could use in terms of developing some safe havens here in Chicago.
Thank you. We are approaching the end of our webinar. there is just one final question, and they were interested in knowing whether or not your clinic has adopted electronic health records.
Yes, we have adopted electronic health records. We recently went live with PowerChart, Cerner PowerChart, August 13th. So this is a recent go live where we're now documenting all of our notes. We're adhering to the meaningful use core and menu required items. So our system has attested for meaningful use, and we've recently implemented patient depart process, a formal depart process, and with every patient visit, we're giving a clinical summary or a patient summary of their visit. So yes, we have. It's been a sort of stressful process going from paper to electronic, but it's pretty much the story everywhere. But yes, we have.
And Dr. Mason is he's being modest, but he has recently gotten a promotion, and in addition to his Project Brotherhood responsibilities as co-lead physician here, he is also the Chief Information Officer for the Ambulatory Community Health Network. So not just for Project Brotherhood, but he is responsible for putting together this system and maintaining this system for the entire clinic system within the Cook County Health and Hospital Service.
Great, thank you. I just wanted to thank our presenters once again for offering such great suggestions. And I also would like to thank our participants for attending today and offering and asking questions. If you have any other questions or assistance, you can always email us or contact us at 703-812-8822.
Well, I just want to thank you for being just a great moderator.
Thank you. If anyone would like to contact us, our contact information is currently on the screen. And once again, thank everyone for participating, and have a great day.